who is going to be talking on science and research makes even an individual practice wholesome. On to both of you.
Hello. Hello.
Yes, your voice is coming.
So is the screen visible?
Yes.
So may I start now? A very good evening to all. Am I audible?
Yes, you are audible. Yes, you are audible.
Thank you very much, sir. At the outset, I would like to thank Chitra ma'am for giving me this opportunity to speak in front of this August gathering. So I am Dr. Navendu Rai. I am a solo practitioner practicing at a small town in UP East that is named as Devariya. And I did my MBBS, MS, I did my fellowship in vitreoretinal surgery, and then I did professional diploma in clinical research. And a person who has done a degree in clinical research is going to speak that he should not be doing research, but he should leave the science and research to the institutions. So when I was doing my fellowship in vitreoretinal surgery under the guidance of my mentor, Professor S. Natarajan, I did PDCR. I was also a co-instructor in the Novartis study of CNVM, secondary to pathological myopia. I was presenter for principal investigator in the UNVEIL study. I did follow-up ethics committee correspondence, adverse event management and trial meets in the VIEW2 study. I was co-investigator in the occupational eye injury, which was done by the University of Malaya, wrote a chapter ocular therapeutics in third edition. And along with this, I have attended so many research workshops, which was organized by the Indian Journal of Ophthalmology. So after doing all these things, when I was entering into my solo practice, I was already a research participant and I wanted to be a research leader. But what happens when you start your clinical practice, in the early practice, when you are ready for research along with clinical practice, there are no patients, a very small amount of patients and to do research on. So in the initial phase of time, I had one case report which was published in IGO. And apart from that, there's no publication after that. So what happens once your practice increases, there are so many patients, but there is no time for research because now you are more involved in paperwork, clinical practice, staff management, and so on, because you are a solo practitioner. So what happens with time, you come to know about this four-wheeled car and how to balance a four-wheeled car. You have four wheels, that is profession, family, yourself, and your friends. When you are, when one of the for a good balanced car for smooth running, you require all the four wheels running in synchronization. As the profession increases, you get less time. And when the profession increases, research takes the backseat, that is the stepney of the car. Slowly you start thinking, what actually makes patients choose one doctor over the another? Is it research? I could not find any of the study reports which say that research does makes a difference in your clinical practice. So now you start making goals for your medical practice. You think about what should be the goal of your medical practice as a solo practitioner. It should be good clinical results. There's always, you have to think about the patient satisfaction. You have to do timely repayments of EMIs because you are a solo practitioner. You have invested so much in your in machines. So timely repayments of EMIs is important. Staff management is important because you are a solo practitioner. Nobody is going to take care of your staff. If in a solo practice, usually the number of staff is less. And research, what happens to research? The research, you think, okay, I'll go to conferences and I'll think I will be taught about the researches which is being done by others and enlightened myself. So what happens to the research? Finally, you think, okay, let's leave the research for the institutions. So I have given a problem. I think Dr. Prashok will be telling us, how can you do it?